Last week, we talked about puberty. Was it a little uncomfortable? Maybe. This week, we're going to do it again. We'll be talking about sex. Again, it's part of our job to make sure our district is armed with as much knowledge as possible when they're making decisions. This is a topic that I'm sure no one is terribly comfortable talking about, but it is something that needs to be discussed. We'll try to keep things as clinical as possible again, using proper names for body parts. So here we go. Let's start easy. What is sex? Well, it could mean a couple of things, actually. It's often the word used to explain gender. It could also be the way that two consenting adults express their feelings for each other with their bodies. Without delving too deeply into the mechanics of things, during sex you can talk, touch, play, even cuddle in very, very different, special, and private ways. What you personally think about sex may seem clear and straightforward, but when it comes to laying the groundwork to help your kids develop a healthy understanding of sex, well, having that conversation can be awkward and overwhelming. Now, sex is an important part of being human. While it can sometimes be something that is strictly physical for people, it can also be more than that. It affects how we feel about ourselves as males and as females. Openly discussing sex with your child will enable you to provide accurate information, whereas not discussing it can lead to misinformation and might not reflect the personal and moral values and principles you want your child to learn. Why should you be talking to your kid about sex? Well, the real question should be, why shouldn't you? Talking with your child about sex is important to help him or her develop healthy attitudes towards sex and to learn responsible sexual behavior. You need your preteen or teen to understand the possible consequences of being sexually active, including pregnancy, sexually transmitted infections, and all the emotional trappings that come with being a part of a sexual relationship. So what do you say? Focus on the facts. Explain the anatomy with proper terms. Everyone has reproductive parts, it's no secret. Plus, children who know and use anatomically correct names for body parts are less likely to be abused and more likely to put perpetrators behind bars. Explain how someone gets pregnant. Explaining birth control and contraceptives is a conversation you should have with your child, because part of our job as a health department is sexually transmitted infection investigations. We would much rather you know about birth control and condoms than to have to call you up and tell you that you have an STI and we need to inform your partners of this. Believe me, talking about condoms with your child is a much less awkward and uncomfortable conversation to have. Talk to your kids about the urges they'll have. Things like masturbation are normal. Again, if they know the safe way to do things, everyone will get to skip those uncomfortable conversations with the doctor explaining why you're having issues. Talk to your kids about sexual assault. Tell them where to draw the line for themselves and that no means no. Teach them that if they are sexually assaulted, it isn't their fault and they shouldn't be ashamed to come forward with it. Talking about sexual assault with them also includes talking about putting themselves in high-risk situations. So never leaving your drink unattended or accepting rides or going to private places, even going to places alone with strangers. How open should you be when talking about sex? Well, some parents are uncomfortable talking to their kids about sex. It may help to practice what you're going to say before you sit down with your kids. Be sure to pay attention and listen to what your child says and asks. It may be helpful to have both parents present for support, not just for the kids, but for yourself. If your kids see that you're open to talking about sex with them, they're more likely to come to you when something happens. Some kids may be embarrassed to talk about sex or to admit that they don't know something, so they may not ask direct questions. Look for opportunities to bring up sexual issues with your children. Opportunities may come from something you're watching or the appearance of visible changes in your child, like the growth of breasts or facial hair. Explain the physical change process and the sexual arousal process. Remember to respect your child's privacy and try to show that you trust him or her to make good decisions. Give them the confidence to grow and mature. We want everyone in our district to be informed. We don't want you or your children to be a statistic we have to report on. We want you to be as safe and healthy as possible and make decisions that are best for you. Having these conversations with a parent is going to give your children a healthy outlook and attitude towards sex. They'll know they can go to you with their problems. Two Rivers Public Health Department has many resources and educational materials to help you know what to say and do.